Welcome to our presentation about addiction. We are going to give you some useful information about this disorder, and then we're going to present some videos. Addiction is a compulsive disorder in which a person must engage in activity or ingest a substance despite its negative impact. The DSM V says that the substance use disorders has a diagnostic criteria. It established 9 types of substance-related disorders: alcohol, caffeine, cannabis, hallucinogens, inhalants, opioids, sedatives, stimulants, and also tobacco. Some of the signs and symptoms we will find in our patients or in people with these disorders will be impulsiveness, loss of relationships or job due to the focus on the object of addiction, also impairment, overdose, withdrawal from the substance too, poor appetite, poor self-care, social isolation. And then some of the physiological symptoms would be edema, fatigue, shortness of breath, also damage to major organs. The signs and symptoms of withdrawal vary by the substance that the patient is addicted to, and it may require medical attention. The assessment is done by the professional, and it includes screening, brief intervention, and referral to treatment. This addresses the growing public health problem. There are three main parts. The screening is performed using a standardized tool by the RN or any other healthcare worker in a setting. The second one is a brief intervention, and it consists of the RN or the healthcare provider providing the patient with the education about the health risks involved in substance abuse. And the third one, the nurse or the healthcare professional makes a referral to treatment with specially trained professionals for the patients who test positive during the screening process. The pathophysiology. Dopamine is a neurotransmitter responsible for pleasure and rewards. Drugs such as opioids increase the availability of dopamine at the synapse, producing positive reinforcement for drug use. Alcohol and sedatives depress the central nervous system and alter the mental status by enhancing the effects of GABA, the major inhibitory neurotransmitter in the central nervous system. Some of the interventions are promote sleep and safety, encourage health eating since the patient might not be eating as well, support the patient to improve the hygiene, establish a therapeutic communication and relationship, identify and help in developing healthy coping skills, help the patient set goals, provide basic level assessment, and then make referrals to a professional trained in substance abuse treatment. Some of the pharmacological interventions are disulfiram for alcohol maintenance, carbamazepine for alcohol withdrawal, methadone for opioid, naltrexone for detox, and Chantix or Ibupro or bupropion for nicotine withdrawal. Some potential diagnoses of nursing are risk for suicide, risk for injury, disturbing sleep pattern, nutrition less or more than body requirements, and self-neglect.